Adenomyosis, the simplest way to think about it is kind of like endometriosis within the muscle wall of the uterus. The tissue that makes up the lining of the uterus or something similar to it is growing in the muscle layer of the uterus. And so what happens is the uterus almost acts like a big bruised muscle. So every time that you menstruate, those little pockets of endometrium within the muscle, they respond hormonally as well. And just like you would have with a period, those are kind of almost bleeding internally within the muscle, causing inflammation within the muscle. And a lot of the symptoms emanate from that. So if you have a painful uterus, unfortunately, the uterus doesn't contract as well because the muscle fibers don't line up like they normally should. And patients have heavier, clottier bleeding. There's nerves that come off the back of the uterus. So the patients often have a lot of back pain. They may have a lot of pain with intercourse, which can also be seen with endometriosis because the uterus sits behind the bladder. You have the bladder that fills up on it and may have irritated bladder symptoms as well. And so there is a lot of overlap between endometriosis and adenomyosis, but you really have to try to differentiate the two